Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. We start to learn basic of health promotion in the third meeting. In this meeting, we will learn about milestone of health promotion. In the last meeting, we already learned about basic of health promotion, the definition of health promotion, and the example how to create or how to do health promotion in the public. So for the milestone of health promotion, there are a story of health promotion that will start from Deklarasi Alma-Ata on 1978 and Ottawa Charter 1986. And then the third in St. Paul Statement Sweden 1991 and the fourth in Indonesia on Deklarasi Jakarta 1997, Mexico 2000, and then in Bangkok, Thailand, Charter on 2005, in Nairobi 2009, Helsinki 2015, and in Shanghai, China 2016 that already conducted. So before we start to learn, let's say Bismillahirrahmanirrahim. In the next slide, I will explain to you about Alma-Ata Declaration on 1978. It is the part of the story of basic health promotion that we have to know. Actually, a lot of story of basic on health promotion, but this one we have to know more. I will put the picture in this slide. Just wait a moment. Okay. To start, the produce the main strategy in health achievement for all, health for through primary health care. So, in Alma-Ata Declaration, the keyword is to produce the main strategy in health achievement, how to get health achievement through primary health care. What is the primary health care? Primary health care we can find in Indonesia, for example, in public health center. Public health center just found it in the capital city or a big city and etc. But in the village, it's difficult to find primary health care. Maybe we can find, but it's not a lot of the total is not the biggest or it's not the same if we found it in the city. So the primary health care in Indonesia, we can conduct by public health center. And then the second is hospital. So there are the basic six in the health promotion. The first is health promotion, and then the second is environmental health. The third is disease eradication. The fourth is reproduction, family or family reproduction, and reproductive health or health reproductive. And then the fifth is community nutrition improvement and health services. We will learn for the first part. Basic health promotion have the first stage is health promotion that we already learned last week that health promotion is the something we have to do as a health worker for increased health in the public. So what is different between public health workers and another health workers? The point is in the public health we have to increase the health for public, not one by one, like one patient for one health worker, but one public health worker is for a lot of public in the public, in city or in the village. And then the second one is environmental health. Environmental health that we already learned before. I will show you again about this. Yes. The health decrease that can influence health decrease one factor is biological, chemical, physical, and environmental factors. So environmental factors, it will influence health decrease that we already learned, and now we discuss about it again. Environmental health. So we have a good environmental health for increase our health. So The third is disease eradication. For disease eradication, we already know we have two types of disease. The first one is the communicable disease and non-communicable disease. And then for reproduction, family and reproductive health. And then the fifth is community nutrition improvement. So for diet, for our diet, we have a good community nutrition improvement for make sure that our health, our food and beverage and etc. is a good nutrition, not just for it, but we have to choose the best food for our body. And the last one is health services. For health services that we already mentioned about a public health center, hospital, clinic, and all of extension that will give the public for services of the health. We call it health services. So the next slide, we will learn about the Ottawa Charter, 1986 in health promotion strategies. On 1986, there are already Ottawa Charter that mention about advocating, enabling, and mediating. So in the Ottawa Charter, there are three keywords that we have to remind, that we have to remember about the advocating. Advocating is the process for lobbying someone or who have like in the hospital, we will call a director. The director will give announcement or give a policy for increase the health. So if we want to do advocating, we will do it with the higher or the top manager in the health extension. And then the second one is enabling, or we call it in Indonesian language is pemberdayaan. Enabling, we will found it in the community services that we already mentioned last week, that we can or we will conduct it with public for increase their health and make they want to do best or the good habit in the health. And then for the mediating, sometimes mediating, we need to do mediating if we have a social health problem. So mediating is really need in the if we work in the public, especially in the village. Mediating, usually mediating we will use with advocating. So in advocating, there is mediating for make sure our goal is come true. So this is the 5 main scope of health promotion in Ottawa Charter. The first one is healthy public policy, and then the second one is supportive environment. The third, reorient health service. The fourth, personal skill, and the last is community action. That I already mentioned before. The first one is healthy public policy. Healthy public policy, it means that the policy, one policy that can healthy or make the public health. For example, for using a helmet, when we use a motorcycle, we have to use helmet because it will help in the road and then prevent for the accident. It means we can call it healthy public policy. So the second one is supportive environment. So the environment should support or increase the health, which supportive environment that really mean the supportive environment that really means like health environment, clean environment, and there is no absence or merely environment that can make someone or some people can get the disease in the environment. The third is reorient health services. So the health services should be reorient and representative in all of place, whether in the city or in the village. So the first is the personal skill. The personal skill that we mentioned is about the health workers. So the personal skill, it's related to the reoriented health service too, because most of the health workers, they just job in the city or choose job in the city. They don't want to go to village because they think that in the village it's difficult for getting food or another access. So we have to make a representative balance between in the city or in the village for the personal skill, especially for the health workers. And the last is the fifth, community action. Community action, it's like community services that the health workers should come to the community or come to the public for increase the health, for teach them, for share the knowledge about health, how to make a good habit in the health and etc. So this is in our country, Jakarta Declaration 1997. I will read it for you. First, health promotion is priority investigation which can influence the health determinants and bring the greatest advantages to the people in the society. Health promotion can be different positive if we compare with other efforts in which to increase the equality health for people. Five Ottawa Declaration principles are the successful strategy to be applied. And the last, health promotion needs to be socialized, and being all member sector in responsibility. So the really important things in this in Jakarta Declaration is can influence the health determinant. What are the health determinant? Or we can call what are the health factors that can influence the health that we already learned it before. You will or you can answer my question. This is first question or the one questions for you in this meeting. Please answer. What are the influence, the health determinants? For example, you will answer 1, 2, 3, 4, and etc. You can learn or find the answer from this model or the last model that we already learned. And then health promotion can be different positive if we compare with other efforts in which to increase the equality health for people. So we will concern about this word, equality health for people. Why equality health for people? Because not all people can get equality for health. For example, the poor people come to the hospital, um, they have to or something difficult for get health services because they don't have the money for pay first and then etc. But it's really different with the rich people that can pay first and then get good health services. And then the last is health promotion needs to be socialized and being our member sector in the responsibility. So health promotions is need to be socialized. All of people have to know what is health promotion, what is for, and what is the benefit from the people if they do health promotion or they get health promotion in their place. This is the same. You can learn and read. Okay, in Bangkok. So I will next my explanation after this. Don't forget to answer my question. One questions that I have given to you. Please answer correctly and we will next hour study after this. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.